Hello, I'm Dr. Tom Oakley, Chief Executive of Feedback Medical, the manufacturers of Bleepa. Today, I'd like to explore how Bleepa is transforming referrals through the addition of diagnostic imaging. Bleepa is a unique communication platform designed around individual patient episodes, and it allows you to securely discuss patient cases, seek second opinions, and refer cases to different care settings, all supported by access to diagnostic patient imaging. An image says 1,000 words, and we should be making greater use of them in clinical practice. When making referrals, you can add patient photos to enhance the clinical view. Even when receiving investigations and discharge information, you can now see your patient's imaging, even being able to show it to them during a consultation. Bleepa is already making a difference in the secondary care setting in Manchester, where it has saved an average of 36.3 weeks of clinical time in a year. Now I'd like to invite my colleague Nick Mayhew to discuss how Bleepa can help within the primary care setting.
Thanks, Tom. Hi, I'm Nick Mayhew. What I want to talk about is some of the feedback we've had around current systems and how those systems interact and the value that both secondary and primary care clinicians derive from it. But also I want to talk about how we think Bleepa could potentially enhance that experience or add some value. So it won't be any surprise that some of the feedback we've had around ERS and some of the associated applications, RAS and ANG, are a little bit clunky, and there have been some frustrations. And in particular, the feedback has been around the value that would be derived about having associated and aggregated access to information across healthcare professions, across secondary and primary care, and then the value that would have, and more interaction. So there's just a lack of dialogue, so communication between the providers, specifically around a patient and a patient episode and that journey. ERS can be perceived to be a little bit complicated, restricted uploads, particularly when using imaging. The file size is relatively small, and you can't really make adjustments to that imaging and ask specific questions around a particular image. One of the common bits of feedback really is around the rejections and the confusion associated and the lack of description around those rejections and why they've been rejected. Totally understandably at the moment, there's very significant waits, long waits, but they are causing some confusion and some frustration. And the lack of communication coming back to the GP or the referrer around why that wait is happening and what the resolution is. I'm obviously going to talk about imaging because that's what Bleepa is all about, but when the communication comes back to the GP following a referral, there's just lack of, there's no imaging there to start with, and that would really enhance the patient experience. So it would be much, much better if the GP or the referrer could get access to that imaging and really sit down with the patient or one of their colleagues and really be able to discuss that imaging and the associated notes. And equally, that the process is a little bit linear. It would be really valuable if that was much more collaborative than it currently is at the moment. Okay, so how do we think Bleepa is going to add value? We really think it's about putting the patient right in the middle there, right in the core of that decision making, and creating a team around that particular patient that can communicate at a time and at a place that suits them. So it is about a better sharing of information with those really important imaging. Because Bleepa is a remote mobile application that can be used on a PC, but equally it can be used on a mobile or a tablet. That really suits all the users. So wherever you are and whenever you want to access, that can be done. So you can have that asynchronous case discussion at a time that suits you. We believe it's a better patient journey. It enhances the patient experience. and it speeds it up, whether that's face-to-face or whether that's virtual. So thank you very much for your time. We really appreciate it. And if you have any questions, we'd be really happy to answer them. So thanks for listening.